Good afternoon, everybody, and welcome to Dr Steevens Hospital for the HSE press briefing. I begin by asking our panel to introduce themselves. Damien.
Damien McCallion, HSE National Lead for the Vaccination Programme.
Colm Henry, Chief Clinical Officer, HSE.
Niamh O'Byrne, National Lead for Testing and Tracing.
Paul Reid, CEO, HSE.
And we're joined by Margaret, who's our Irish Sign Language interpreter. And you can see this on HSE Live's Twitter feed or on the RT News channel. I'm David Leach, Deputy National Director of Communications, and I'll ask Paul to commence by giving us an update. Thank you.
Thanks, David, and good afternoon again, everybody. Early this morning, I think all of our days got off to a really bright and positive start with Kelly Harrington qualifying for an Olympic final. And I hope this afternoon we can keep some level of positivity going with a few updates we want to give you. But specifically in relation to the 6 millionth vaccine that we know has been administered earlier on today, mid-morning, which I think is a great milestone. And also we'll give you some further updates and news in relation to the opening up of the online registration for the 12 to 15-year-olds children vaccination programme for next week. But overall, I think a very proud day for Ireland overall, with Kelly Harrington and indeed the 6 millionth vaccine. Just looking back to the last weekend we've just been through, and we know for the past 16 months there's been many horrendous weekends that we've all been through in relation to COVID, many that we will all want to forget. But we do hope the last weekend in particular was a very significant milestone in our relentless challenge to exit our way out of this awful pandemic and its consequences. And indeed, like so many times in the past of our own history, it was the young people who showed up in great numbers to be part of what was a very momentous weekend for ourselves in the HSE, I think for Ireland overall, but particularly for the vaccination programme. And the HSE, we always believed that there was a role and a value for walk-in centres at a point in time. And we did believe it would be a good mechanism to encourage further uptake across all age groups, particularly to target some of those younger age populations who hadn't registered to date for vaccination. But we were genuinely taken aback by the overall experience over the course of the whole weekend, and particularly by a few factors. Firstly, the number of people who attended, and particularly younger people. Secondly, the attendances proved very strong all across the country. So not just in urban areas, but rural areas all across the country in the vaccination centres in proportion of population. And thirdly, whilst it was predominantly younger people that we saw coming through, there was also attendance by all age groups across the board. And I'll touch on that shortly again. The reason given by younger people as to why they came forward, which was covered in many of your own Vox Pops, were a few reasons, but the one that stood out for us was firstly to protect themselves, which gives us good encouragement. Secondly, to protect their family. And thirdly, to get their lives back to some level of normality, which are all areas that we share with them. And I think the overall good feeling in the centres each day was really remarkable to see. But also the wider good feeling amongst the whole population, seeing what was happening last weekend. And just to share with you a few kind of facts of data from last weekend, many of which we will have shared already, but just to give you a context of it, over 30,000 persons attended at the walk-in centres, and over half of those overall for the country hadn't already registered on the portal, which is exactly the target groups we were trying to get to. Approximately 65% below the age of 20. But overall, if you just take within their 20s, below the age of 30, about 85% of the people who attended below the ages of 30, which is really, again, great turnout. But also say there was representation across all age groups. Many centres, particularly on Sunday and Monday, I attended some of them, were reporting people in their 70s. And indeed, the oldest person that we had shown in attendance was an 83-year-old in Sligo. So again, exactly the process that we wanted to encourage across the board for attendance. So I do want to appreciate, on behalf of the HSE, our great thanks to all of the people, public who showed up throughout this process for the support through it, and indeed for all of our vaccination teams in all of the centres all across the country. But there was also another figure of 30,000 that we'd like to share with you for last weekend, which were 30,000 people who attended our COVID testing centres across the country. And I think it's important to always remember that as well, because that really is a really keen reminder that the virus is still out there and still very prominent in the communities. So Niamh O'Byrne, my colleague, will shortly update on the overall figures for last week in testing and tracing numbers. But I just want to make the point early here, as we do often. As we are seeing those numbers still come through the centres, it's really important, and we're pleased that people are coming forward for tests. But again, I'll make the call. If you are feeling symptomatic, do what we encourage everybody to do. So do isolate, do seek a consultation with your GP, do self-refer yourself into one of our centres, or indeed come into one of our centres, but are self-referable. We would encourage, if you have symptoms, to take the right precautions immediately and early, and don't socialise. So for now, we need to continue our approach in the HSE, and we will continue, which is a combination of the vaccinations, trying to get to the remaining target population, the testing and tracing swabbing centres all across the country that we will update you on shortly, and also encouraging everybody to still stick resilient on the public health measures that are really important for us all. On our hospitalisations and ICU, again, we continue to see a slow but steady increase in the numbers of people in hospital in particular, and indeed recently in ICU. Today, there are 193 patients in hospital, COVID positive patients, inpatients, which is up 26% again on last week. And remember, last week we were showing a 60% increase on the previous week. So they're steady rising numbers in our hospitals, which again give a stark and clear message to everybody. It's still transmitted, the virus is still transmitting at a high level in the community, and we're still seeing a steady growth, thankfully off a smaller base that we had at the start, but a steady growth in hospitalisations. 30 people in ICU, so critical care has been relatively stable over the past 3 weeks, although there are signs of a slow increase. And again, we'll always remind there is a lag factor between hospitalisations and what we see coming through in ICU. I mentioned last week that we're continuing to capture some more detailed information in relation to hospitalisations. And again, as I made a point last week, it's far too early to draw any conclusions from that. But I will make a few brief points on it. Firstly, it's not demonstrating anything alarmingly different than what we already know. And that is firstly, that all cases of positive COVID patients in our hospital have a very disproportionate effect on our health system, as we have to isolate, we have to run infection prevention control measures, we lose capacity on beds, etc. Secondly, most COVID positive patients that are hospitalised are people who require hospital care because of COVID. And that's an important point I made it last week, I'll say it again. Thirdly, the impact of the vaccination programme is having quite a striking impact and benefit in relation to ICU admissions. Significantly higher proportion of the COVID ICU patients have not been fully vaccinated. We expect to be in a position to present some more of this data on a regular basis from next week. But again, we're finalising some of that data as we speak. Just getting back to the vaccination programme, briefly just to share a few current issues with you. Our major focus continues to be delivering first and second doses, and then to all adults and indeed to those over 16. Along with this, as you'll know, we have 3 key priorities. Commence the process of the vaccination of 12 to 15-year-olds, develop a scenario plan to administer a booster programme when advised in further detail by government. And thirdly, implement some further walk-in facilities for this coming weekend. So just to briefly update on each of those, for the 12 to 15-year-olds, we will be opening the online registration system for those in the 12 children in the ages of 12 to 15 from next Thursday, the 13th of August. There had been 3 aspects we've been finalising in detail, which were the communications process, and the information on this will be on our hse.ie site. The consent process, how about the process by where the parent or guardian registers the child, and indeed the verification of that process at the point of vaccination, and indeed the IT process that we've had to make changes to our system for the online registration. So full details of how to register the process, the information that will required for registration and indeed for verification at the point of vaccination will be on our site this afternoon. Secondly, in relation to developing a plan for booster vaccination programme, we will await further guidance from NIAC and indeed agreed policy decisions from government in relation to this. We do envisage there being a booster campaign, and we're certainly planning for that scenario. Inevitably, the advice from NIAC will focus on those that are most vulnerable, and that's been, I think, communicated out, but no surprise going back to those vulnerable groups where we started the vaccination campaign. And indeed, again, we'll wait for further clarity and a policy decision from government in relation to that. On the walk-in facility, just to state, we do feel that there's still a further potential in the walk-in facility process for vaccination centres across the country. Therefore, we will be running these again this coming weekend, the 3 days over the weekend. We do feel that last weekend we will have captured probably most of this opportunity that there is there, but we once again open the facility to see if there are some further people that we can cover and capture through this process once again. Again, details of all the centres and the times for walk-in the centres, please, available across the country, please do check on our hse.ie site. So finally, just to give you some final statistics on our vaccination update, we've now, as I mentioned earlier on, administered over 6 million vaccines. Over 3.3 million people have now received their first dose or single dose of their vaccine, which is approximately 89% of adults. And over 2.8 million have received their second dose or single dose, which is approximately 75% of adults. And the uptake continues to remain strong. Just to say to you, I'll give you the summary of uptakes. For those 80 years plus, 99%. Those 70 to 79 years, 99%. 60 to 69, 96%. 50 to 59, 94%. And 40 to 49 is 89%. Last week, you'll have seen we administered over 284,000 vaccines. This week, looking ahead at we will be looking somewhere in the region of between 200 and 230,000 this week we're in. And next week, commencing 9th of August, somewhere over 200,000. Again, that's all based on available populations coming forward. I'll leave it at that and I'll pass you to my colleague, Niamh Byrne, for now, please.
Good afternoon, everybody. I'm just going to give you a brief update on where we are with testing and tracing. So testing demand does remain high, but it is steady. So over the last week, we've done nearly 115,000 tests, and that ranges on certain days anywhere between 13,000 and a peak day at 22,000. When you look back at the month of July, July that we've just gone through is the highest month in the pandemic so far in terms of community testing, where we did over 385,000 tests in that month through our community swabbing sites. The next month after that is January, where it was 308. So it's quite a significant difference for what July has delivered across the testing sites. It shows that steady and consistent demand that we've been experiencing over the last number of weeks. The metrics in terms of being able to get your test within 24 hours still stands at 94%, and the end-to-end process is in less than 2 days at 1.9. We still continue with our pop-up testing system, and they are operating at the moment in a number of sites, particularly supporting communities that are very busy for testing, which continues to be Dublin, Donegal, Athlone and Cork. And this weekend we will open an additional site in Dundalk, and we'll probably do that again next weekend in Dundalk. At the moment, the positivity rate across the community walk-in sites and self-referrals is around about 12%. So that is continuing to rise. We continue to have both high referrals from the 15 to 24 age group, but also high positivity. The positivity in that group has now risen to 19.5%. So you can see that's quite up on the 12% overall. Coming into contact tracing, again, continues to be a sustained level of busyness in contact tracing, with over 24,000 contacts made contact with last week. Across our close contacts, household still remains the highest, but transport still remains the highest in terms of positivity level of those who've been a close contact. We continue to see over the weeks the impact of vaccination in contact tracing, and we now have 35% of our close contacts fully vaccinated, which is 5% up on the prior week, and continues to take those individuals, if they don't have symptoms, out of our testing system. Of our index cases at the moment, one of the challenges we do have in tracing is people answering the phone. So again, we would ask and encourage people, if you are an index case, you know that because we've texted you, we are going to follow up that quite quickly with a phone call. It takes a lot of time for us if we have to call 5-6 times and then run into the next day. So we do encourage people, please take that call. It's an important call. It has important patient data, but it also has your close contacts, and that way it helps us stop the onward spread. So in an update on antigen testing, we have been running antigen testing as a pilot in third level that started last week, and that's going to continue to grow over the coming 4 weeks. And on Monday, we start in a selection of creches across the country in Dublin, Cavan, Mayo, Galway and Wicklow. So we'll start to see the results of those in the coming weeks. We intend to run them for a minimum of 4 weeks and then look to whether the programme gets expanded further based on the success or not. At the moment, the process seems to be going quite well. People are getting used to the tests, getting used to them, being comfortable with them. And so far, we have no detected cases, but that will continue over the coming weeks as we grow that. So that's really it from testing and tracing. Thank you. I'll hand over to Colm.
Just want to update us on the progress of the illness and where we stand. Also, some commentary on the vaccination programme and its impact it's having. So our 14-day incidence peaked in the 7th of January at almost 1,500. It's now at 368, and that's up slightly, 4% in last week. The 5-day moving average, again, you see how high it was in January, now at 1,278, and it's being at this level between 12 and 1,400 per day now for some weeks. It's a slight rise in last week, and new cases 2% up in last week. So what we're seeing if it is a rise, it's a very slow rise. Hospital admissions, you've heard, are higher than that figure showed there, but again, creeping upwards. There has always been this lag between the cases as they're reported and the time it takes for some of those cases to become ill and require hospitalisation. And of course, we now know, because of the impact of the vaccination programme, that conversion rate is lower than it was before because less people become sick. They're protected from serious illness. We know that from the effectiveness study of the vaccines here and abroad. ITU, again, creeping upwards. The number we look at for hospital admissions is the number of new admissions per day, which is around and about between 22 and 25 per day, and is quite steady. ITU admissions, there were 3 last night, but again, 1 to 2 per 24 hours. So new cases in Ireland have risen in the month of July from a weekly average of 485 at the start of July to 1278 last week. And you can see then that red line, that a remarkably steady, if a rise at all, it's a very slow rise in the cases throughout July and beginning of August, and contrasting somewhat with the rise in hospitalisations as those cases converted into harm into those people who became unwell. And similarly in ITU, a very slow rise, an increase from this last month's low, not this month, but last month's low of 14 and now approaching 30. And where are we? Well, to Europe, a 14-day instance is reported by the ECDC, and they're relatively high, but not nearly as high as countries like Cyprus or Spain, which have risen quite dramatically in the past few weeks. Cases continue to rise in some other countries. Looking at counties, the Donegal remains quite high at 795. It's decreased slightly in the last 2 weeks, but remains the county with the highest rate, with Louth and Galway similarly quite high. So looking at the age groups in Ireland, again, that similar pattern, which has been certainly changed by the vaccination programme, where we see a very, very few cases in over 85%, it's 0.3% of total cases in the last 2 weeks. And in over 65-year-olds, only 3% of cases. And the great bulk of cases in the 19 to 24-year-old age group, 25, 34, and 13 to 18. And those under 13 years of age accounting for 11% of cases. So again, we're seeing that shift left, a definitive shift left of cases going down towards those who are unvaccinated or partly vaccinated. And that shift left, leaving those bars very low in those who've been fully vaccinated. Again, underlining the great degree of protection that those populations are having because of the large degree of uptake. What does it mean in terms of harm? We've talked somewhat in terms of hospitalizations. If we were talking back in January, the top left nursing homes, we were talking at 7 outbreaks per day, many with lots of cases, many hospitalizations, many seriously ill, and sadly many dying. Similarly, in community hospitals, we've been seeing the same. For 2 outbreaks in nursing homes the past few weeks, but it's not just the outbreaks, the numbers of cases, much smaller numbers of cases associated with them. Likewise, in acute hospitals, we reported a couple last week, one particularly large outbreak with 15, 16 cases, but the 2 this week, 12 cases. The risk is always there, but it's much, much attenuated now because of the uptake of vaccination among the various points of entry, potential points of entry for the virus into a hospital, such as healthcare workers, patients, and so on, all now covered with the vaccine. So over 4.2 billion doses administered worldwide, and the map is now getting a more even distribution. You see countries like Chile and Uruguay and others very high levels of uptake, and a more equitable distribution across certainly the developed world, but sadly not the developing world. And you'll see the comments of WHO and others calling for more equitable distribution of what vaccines are available. First dose vaccinations in the EU, well, we've had remarkably high uptake across all age groups. And we wondered at the beginning, was it just a function of older people being afraid and having been cocooned for so long and looking at this as a passport to freedom out? Whatever the motivations and incentives were, and in any vaccination centres I've been in myself, you do see a variety of and last Saturday, for example, in Cork, I asked people when I was vaccinating why they took it up. Many took it up for the freedoms associated, but the predominant answer was that of solidarity. They saw it as part of their the protection, not just for themselves, but for those they're living with, for broader society. And I've no doubt they're telling the truth. And you'll see there we are in top EU countries for uptake of at least 1 dose. We're now in 2nd place, which is really remarkable. Why is this? Did we see this? Well, there was a Eurofound study done back in March, which showed that Ireland had the lowest vaccine hesitancy rate in the EU. It kind of went unnoticed at the time, but the figures are quite remarkably accurate and prescient in terms of what they predicted. And at that time, they said that 87% of Ireland's surveyed population was at least rather likely to get vaccinated, which proved to be a euphemism in terms of what actually happened, how that translated into real life activity. And we see some of the uptakes in the countries which are less, what is more vaccine hesitancy reflected in the uptake figures today. So this was a study carried out in March, did seem to predict that there's a strong correlation between how people declared what they would do back in March, what has actually happened. And these are figures from where I was myself on Saturday in Cork. We had to open the walk-in the centre early for the walk-in vaccine, those who were queuing, because there were so many queuing outside. And that's a team led by Deirdre Phelan and Dr. Cathy Banstead, who were a model of optimism and encouragement, and egged on, no doubt, by the people coming in who were the positivity was complete. It was really something to behold. So our age groups who are registered for the vaccination, and of course there's a very close link between the registration and what's actually happened now, because and you can see those remarkable figures of the older age groups, all of which we could have said if we were pessimistic was because of the risk they had. But look at the 40, 49-year-olds, remarkably high registration. 92% have either received the vaccine or been registered. 30-39s approaching 90%. 18-29s, which is still ongoing, approaching 80%. And 16-17-year-olds just open up 61%. Now you can focus on the red if you want, but it's getting smaller all the time. And as you've heard in the walk-ins, we're picking up people who are perhaps late uptakers, people who weren't so sure the first time round, didn't register for whatever reason. They're finding another reason to come now. And then how does that translate into those being fully vaccinated? You've heard these figures already, well over 90% right through those age groups, and looks like 40, 49-year-olds, if all those are fully, if dose one vaccination, 85%, get the second dose, it'll be 90%. And 30, 39-year-olds may well reach that yet because it's still active, similarly with the other age groups. So we're seeing uptake levels we really couldn't have dreamt of back in March. And even that predictor, that survey carried out throughout the EU, while it certainly predicted there were high levels of enthusiasm in Ireland, understated the actual real-life uptake, which results in nearly 90% of the eligible population having received one dose and 75% fully vaccinated. And you can see the square filling up there with the dark green and the bright green, and the greys diminishing every day as we talk. So in terms of impact, ITU, this is just looking between April the 1st and July the 29th. It's not steady state. Some of these people were pre-Delta. So you're talking about Alpha, the predominant variant before this was Alpha, a nasty variant, but perhaps not as transmissible as the Delta, and some shared features in terms of vaccine resistance. But of the 143 who were admitted to ITU in this time period, the great majority, almost 80%, occurred in the unvaccinated population, and the smallest proportion occurred in the fully vaccinated, 6%. And of the 31 patients who were admitted to ITU and were at least partly vaccinated, 27 had an underlying condition. Just a couple of studies to react to, again, the UK REACT study, around 13 fully vaccinated people, 3 times less likely to test positive. This study follows up almost 100,000 people sequentially or repeatedly testing them for COVID-19. So 3 times less likely to test positive. Vaccinated people had a 60% reduced risk of infection, including asymptomatic infection. And the study suggests the fully vaccinated people less likely to pass it on because of lower viral loads, all of which adds to the general positivity. So you've heard this R value, we used to talk about it a lot, and this R value here applies to populations without public health measures, without vaccines. In other words, in its wild natural state, how transmissible is the variant. And the original one we dealt with in the Wuhan, 2.4 to 2.6, and that's without any social restrictions, without any social measures, without any vaccination. The Alpha, which is the one we dealt with in late December, early January, 4 to 5, quite transmissible. The version causing Europe's first wave, 3, the Delta, 5 to 8. And to give you some context, measles is 15, extremely transmissible virus. But you can see that these successive waves we had were caused by variants that were more and more transmissible, causing us all that disruption. Variant, where are we now with that Delta? Over 3,266 cases proven by genomic sequencing. We have no doubt that it's now by far the dominant variant we have, as predicted by the ECDC, who said by the end of August it would be over 90%. Looks like that might have been understated. What's happening in the UK? Cases starting to decline more. We saw a trend the past couple of weeks. People were wondering what this meant, and there was conjecture over the peak and how it was linked perhaps to the European Championships and so on. But cases starting to decline, peaked between 50 and 60,000 per day. The 1st of August, 18,000 cases reported. And the number of daily cases admitted to hospital also seeing a slight decline. There is a lag always of a couple of weeks. So what they want to see, what everybody wants to see, is that fall in cases continue, and that mirrored by a fall in hospitalisation and not just stabilisation of deaths, 49 reported on the 1st of August, but a fall in the deaths too. But if you may recall the graph I showed last week, the correlation between deaths and cases is very, very severely weakened in the UK compared to what it was in January, February, when there was a very strong correlation between hospitalizations, ITU and deaths, and that's greatly weakened, emphasizing again the strength of the vaccine program. USA data, 8-fold reduction in disease incidence, 25 reduction in hospitalizations among vaccinated people, and 25-fold reduction in death. All again, real life experience demonstrating the effectiveness of the vaccine in real life in reducing serious harm. Quick word about long-term immunity. Emerging studies are now showing we produce memory cells to COVID-19, not just antibodies, but cells that kind of stay around in our system with a long-term memory, thankfully, for this nasty virus. And that in some people, this long-lasting immunity, this study of 77 people, shows the number of these memory cells match those identified in vaccinated against tetanus or diphtheria and may lead to longer lasting immunity than we thought. 6 to 12 months after infection may become reactivated and allow our immune system to remember the virus should it come back. And finally, just a summary, Delta variant is a dominant. Its wild state is or not as high as 8, but of course the vaccine and public health measures have greatly reduced that. In the last 6 weeks, that slide I showed in ITU, most ITU admissions, unvaccinated people or partly vaccinated. Some countries now reintroducing public health measures. We're seeing some breakthrough, that's to be expected. No, the flood wall is not completely. It can be breached if the number of cases get high enough and the exposures continues repeated enough for some people. Majority of deaths are ITU and Delta are due to unvaccinated people. So thank you.
Thanks, Colin. We'll move on to questions. So, if I could ask members of the media to introduce themselves when the microphone comes to you, and we'll, as my wont, we'll take 2 questions from everybody and then go around a second time or as many times as you want to get everyone's questions in. Jack, you were the first to indicate.
Sorry, just a very quick one. The walk-in vaccination centres, are they going to be opening this weekend or is it next weekend? This weekend.
Friday, Saturday, Sunday. You can just go to the site and you'll see each day.
Do we have any indication of kind of how many roughly? Is it going to be around the kind of same kind of 20, 25-ish?
Centres open.
Yeah, the centres doing the walk-in.
It was well more than that in total last week. It was 43 centres in total. Yeah. A smaller number of them weren't open, but each day a number of them. So it might be 26 one day, 25 another day. Damien, do you want to?
38 in total going to operate at various times over the weekend. So there'll be some Friday, some Saturday, some Sunday, different slots. That's for walk-in, and they'll still be done their appointments based. So the same rules apply as before. Just check the times because obviously the times are limited in terms of walk-in. We won't be able to facilitate people outside that.
Senator Maloney from the Irish Independent. A real housekeeping question to begin with. Colin, you mentioned that Ireland is now the second most uptakiest, if we can create that neologism, country in Europe. I'm just wondering which is the one that leads us with the most sort of vaccine unhesitancy?
Iceland. I'm getting prompted here from either side. So if it was Who Wants to Be a Millionaire, I'd be cottage cheese.
And then a tougher one maybe for you, Paul Reid, if you don't mind. What do you think might be the effect of the Attorney General's decision that gatherings of 200 people outside are now fair game and so on? Have you any worries in relation to possible spreader events arising now over that clarification by the Attorney General of what we should have all have known long up to now?
No, Senator, from our perspective, look, issues around advice to government, public health advice, issues around the guidelines, regulations, legislation is a policy matter for government, the regs drawn up by the Minister and Department, and the advice given by the CMO and EFIT. So that's kind of that's our role in all that. We implement anything that comes from that. The only extra one point I would say is, look, we're so close to being on the right side of this pandemic, over the next few weeks, as we continue to vaccinate younger people and now children from next week. I've seen it many different times in this last 16 months, different groups arguing for different restrictions to be removed and different people taking different interpretations of it. And the only cause of concern we would have, people just drop their guard in the next few weeks, whether it's out of frustration or confusion, but people drop their guard. So message from HSE is please just stick with this. In a few weeks' time, we'll be on a much better side of this pandemic. So my call is to the public, just don't get confused, don't get frustrated, just stick with what we're doing, it's working, and allow us to continue the vaccination programme.
It's always the job of the bureaucrat, at no matter what level, to separate themselves from sort of policy advice and government advice and so on. But I have to put it to you, Paul, I mean, from a clinical point of view, and you're in charge of this giant beast, the health service, has all this political bungling over recent weeks not made your job far harder? And, do you just wish that the politicians would get their acts together?
Well, I never class myself as a bureaucrat, just to say that up front. But just to say that we're very focused on getting us through these next few weeks, protecting the health system, protecting our hospitals, protecting less people from coming in, being sickness and illness, and that's the vaccination programme for those who do come through, giving them the best of care. And I've seen over the past 16 months all different stages of political issues emerging, sector issues emerging, people's particular interests emerging. And the one thing that gets us all through all of that is the public has sustained through all of that in 16 months. And I'm just calling on them again to just keep our heads focused, don't get distracted. Let's get through this in the next few weeks.
Do you feel let down in any way?
No, look, from agency perspective, we've had the full support of the public. I've had the full support of government throughout this process, and that goes in terms of funding or support for execution of programmes. So we've had support throughout.
Paul O'Donoghue from News Talk. Just first for Dr. Henry, we're asking last week about maternity hospitals and ones which are not operating within HSE guidelines, and you were saying that the aim was to have them all operating within HSE guidelines by this week. Is that now the case?
Yes, we checked in the past couple of days, and they're all 6 relevant hospital groups are now compliant with those 7 areas. If I could just reiterate it, those are the postnatal visits, the attendance of partner and labour wards, the visits to neonatal units, the presence at the anomaly scan at 20 weeks, the early pregnancy assessment unit, attendance for high-risk pregnancies. There have been some complaints, obviously, and we're asking each hospital group to follow up any cases where people say that this has not happened, and the attendance at ED for late trimesters. And we will be looking at additional areas. We've asked our infection prevention control nationally to look at 12-week scans and also caesarean sections. We're trying to get our way back towards where we were before this pandemic was, and that's the difficulty is, can we get back to where we were pre-pandemic? Of course, it's very hard to unravel and pretend the pandemic isn't there, because we know also that the risk of the virus presents, particularly to unvaccinated pregnant women, and those risks are better documented now than they were before. And our task is to balance the core requirement of women and their partners to be present as much as possible during antenatal and during care, labour and postnatal care, with the need also to protect women and their pregnancies from a risk that we know is there, and we know from a virus that is very transmissible, particularly among unvaccinated people.
Thank you. So just to clarify, every single maternity unit then, all 16 of them, they're all fully compliant with the current guidelines. And like you're saying, you'd like to expand those guidelines now as well. If so, when do you think those expansions will happen? So say, for example... issuing renewed guidance tomorrow to the 6 relevant hospital groups, as I said, to look at the 12-week scan and to look at caesarean sections as well, in response to the... and as time goes on, and we have greater confidence in terms of the vaccine uptake in this age group among pregnant women and among their partners, and we have greater confidence that they're fully vaccinated, and that affords them great protection. And of course, we have greater confidence that there will be less and less harm to anybody who's presenting to our maternity services who's unvaccinated. So that's our next stage. We hope tomorrow is to look at that 12-week scan and to look at attendance at caesarean sections. Just the last thing in this then, is the HSE looking to get back to a point where partners would be able to accompany a woman in all cases if they choose, so to all maternity scans if they like?
Well, we're very close to a situation, the figures I showed earlier in terms of uptake for different age groups, now approaching 90% even for younger age groups in terms of dose 1. So we're only a month or maybe a little longer away before we see the age cohort who's most relevant here, people in their 20s or 30s, not just dose 1 who are fully vaccinated. And that will give us all much greater confidence in reversing these restrictions that are brought in to protect people. And let's remember why these restrictions were brought in, not just here, but in nursing homes and elsewhere, was to protect people at a time when we didn't have protection. We are now have much greater confidence from the reach and the scope of the vaccination programme and the uptake, that there's a solid level of protection, including particularly the pregnant women in this circumstance, from a virus that we know can cause harm.
Hi, Niamh Griffin from the Irish Examiner. Can I ask, just in relation to the outdoor gatherings, what kind of reports are you getting from public health doctors about infections outdoors? Is there a risk when you have large numbers together?
Question, Niamh, we were asked this, which is not linked to this recent situation, but we were asked this some time ago when the Delta began to emerge. I think I remember saying at the time that the stories and the accounts we hear from public health directors often anticipated the change we saw in figures and data, because they were seeing the real life histories, the real life outbreaks, and they did note that the Delta, they didn't need those transmission figures I showed you there earlier in the presentation to tell them that this was something that was more transmissible than the Alpha variant they had been dealing with from January and the wild type before then. And they were reporting, if you remember questions I think put by yourself, remember the time about outbreaks in Athlone and elsewhere, they were reporting outbreaks occurring still within congregated settings indoors, but not exclusively so, reflecting that we're dealing with a variant that was much more transmissible. Of course, at that time, we had nearly as much reach of vaccination into that population, and the potential for outbreaks to cause harm and to reach such figures is greatly attenuated now because of the reach of the vaccination program. But certainly, it's nothing new to say that the Delta variant is much more transmissible.
Yeah, from a tracing perspective, I suppose a really important message that we've been hearing from tracers is, even if you're vaccinated and you have symptoms, don't go to a sports training, don't go to a social event, and don't go to work. There are examples now of people who are vaccinated who have mild symptoms and go to these events, but do cause outbreaks as a result. So even if they are outdoors and even if you are vaccinated, it is really important to not attend the event and to stay at home and then go and get a test if you have symptoms.
And that's certainly very strong. The directors of public health too is people who have symptoms, even if fully vaccinated, isolate, get tested. Don't go to work. Don't help spread the virus.
What Niamh was saying there as well, the transport, which is a very high.
Yeah, within the transport, so that's shared cars, buses, trains. Again, don't use transport if you have any symptoms, and then keep your social distance and keep your mask wearing, all the precautions that we've had advised from the beginning, because there do continue to be outbreaks in outdoor settings, in indoor settings where people gather and have come along with symptoms.
Be expecting then, Niamh, when we're seeing like 40,000 in Croke Park and potentially groups of 200 gathering everywhere now, would you be expecting to see an increase in cases then?
I guess there's any likelihood that if there are larger groups of people coming together, but at the stage we are in the pandemic now, I think as Paul showed in the statistics and column, the high level of vaccination will give a degree of protection there. The main advice, no matter how big or small the event is not to attend with any symptoms, because you do have the ability, vaccinated or unvaccinated, to pass the virus on. So that's really the key part in attending any event.
That Niamh kind of sentence question as well, but just, government we're all getting greater confidence by the vaccination programme, both the uptake, but also the benefits that we're seeing. So everybody wants us to get back to a level of normality in society, and I think we're creeping closer and closer to that. But it's so close, it equally could slip away very quickly. So I think the way government have gone about it here is probably the right approach. Other governments gone about it differently, but we all want to get that level of normality back, and we're on the route to it, but it can slip away very quickly.
Yeah, that was kind of one question. What was one sort of, just on the maternity restrictions, there was a study come during the week led by Trinity College, and they found that in a lot of cases, guidelines and advice laid out by the HSE were not being followed by the hospitals, and that there was very little follow through on that. And that would definitely be what women are feeding back to us. Do you think that the interaction between the HSE and the maternity hospitals needs to be looked at now going forward?
We've met with the hospital groups, chiefs, CEOs this week. We've been engaging with them more or less daily. They're very clear as to what our expectations are in terms of compliance to those 7 issues, or 7 items I listed out earlier, Niamh. And we have required from them, directly from the CEOs, confirmation not just of compliance but of their commitment, which we have received. So if there's any exceptions, we've asked them to describe those exceptions to us and explain why there isn't compliance. and they do so on an individual basis with us. And likewise, we've asked them to respond to any individual complaints of lack of compliance.
Just to add, Colin has covered a lot of this today, but I did chair a call with all the hospital group CEOs last Friday with Colin, and as Colin has said, it was not just seeking their compliance, it was seeking commitment and to embrace it in a very positive way, which we got. And I'm happy to say, based on what Colin was reporting back today, they are highlighting to us individual exceptions that they're aware of happened. In some cases, they are contacting the person back or the partner back themselves, even during the course of the day. And in some cases, it had to happen for a particular reason why they had to implement it. So they've given us that commitment that we get greater communications on the exceptions as they happen, or indeed if they have to put in exceptional infection prevention and control measures. So we're able to proactively communicate that out.
Where you'd expect them to respond in terms of any measures they need to take to protect patients from the virus.
Paul Quinn, Virgin Media News. Niamh, if I can just ask you first, obviously indoor hospitality has been going now for about 9 or 10 days. Are we seeing any impact in relation to outbreaks or clusters, specifically in relation to indoor hospitality? And can you give us just some examples of the types of outbreaks that we're seeing across the country?
So since the opening of hospitality, yes, there has been cases and outbreaks within particular hotels and accommodation. When we go through them with public health directors, it's not excessive volume and they're managing them, but they are now a new factor and a new environment for the disease since they have been reopened. We haven't heard any particular concerns that there's any problem with the sector and with the volume of outbreaks that we're seeing. There's just another sector now for public health and the contact tracers to work with as there are outbreaks in them.
Damien, can I ask you, obviously the portal is opening next week for 12 to 15-year-olds. I know a lot of people that have spoken to me who aren't anti-vaxxers, who are delighted to get their own vaccine, but who might be hesitant about letting their children, their 12, 13, 14-year-old children get a vaccine. And maybe they had, felt a bit bad or felt a bit sick after their own vaccine and they don't want that for their children. What would your message be to parents out there who would be a little bit hesitant about having their child vaccinated?
So Colin might want to come in on this as well. Just, I suppose, our aim in terms of the information we're going to provide, which starts from today, tomorrow, is to provide factual, trusted information to people that they can understand and read, that sets out both the benefits and risks to people so they fully understand the decision in relation to the vaccination of children. I suppose what we would say is NIAC have come with this recommendation to vaccinate children aged 12 to 15. We've trusted them right through this process, and there's a huge wealth of experience in NIAC in National Immunisation Advisory Committee in relation to vaccines in general and immunisations, and they've served us well in terms of that advice right through this process of the vaccination programme. So I suppose a couple of things really. One is that the fact that they've made that recommendation is based on evidence, based on science, based on what they believe to be the right thing to do, both for the individual, for the child, for their psychosocial needs, and also in terms of their general health and welfare in terms of education and so on. And those are clearly set out in the guidance that they've fed back to us. Secondly, we will put that information out for people to make their own decision. We've always taken an approach through the programme in communication terms, through our communication team and through public health, is that we put that information there and let people make a choice. And people have responded, as you saw from the figures that Colin said. So I suppose we'll follow that model through, but we recognise that we do need to get to parents to give them that information so they can make informed decisions. Colin might want to add to that.
Damien said everything. Just to add to that, first of all, NIAC took a lot of time over this, a long time. They looked at all the evidence, and she's in the document themselves, in the letter, they said they deliberated a long time over it. That's the first thing. The second thing is there's lots of focus, understandably, on the proportion of the population, and we keep on giving the figures out of the high 90s and the low 90s of different age groups. But NIAC said they focused purely on what was the benefits and risks for children. And so the advice given through the NIAC document is on what's in children's interest. And while there are population and society benefits for having more of the population vaccinated, the advice was based on what is the risks and benefits. So their advice for those who have underlying conditions was unequivocal, and for those who are living with people who are vulnerable were unequivocal, was that by far strongly advised take the vaccine. And then their balanced advice for all others, for healthy children, the great majority of children, was taking everything into account, as Damien said, taking into the disruption, even mild illness because psychosocial education and so on, was the benefit of the benefits weighed towards getting the vaccine. And that's what we're encouraging people to do. But the provision is, of course, is that we provide parents and guardians with all the information they need to make their own decision based on what they feel is best for their child. And that's our job in the HSE, is to give people the information they need to make their own judgment.
Just so you know,
Just to give you some actual numbers, if you've around about 100 outbreaks in a week, they range anywhere between 2 and 8 in a hotel setting. So back to my comment that it wouldn't be significant as a proportion of all outbreaks, and the numbers of cases associated with them range up to 13, but in most cases are quite small. And then in bars or restaurants? A mixture of more in the hospitality side accommodation, but then some in bars as well, and golf clubs, things like that. Not a significant problem at the moment.
Ty from the Times, Sunday Times. What impact will the purchase of the 700,000 Pfizer vaccines from Romania have on the rollout of the vaccines from here on in?
Yeah, so I suppose it's additional supply that will help us to accelerate the remaining part of the programme. I think, as we've said over recent weeks, as we come to the final age groups, there's always a lapse time that will take groups to get through. So it isn't the case if you have 300,000 young people aged 12 to 15 that will compress it. People will naturally need time, and we do find a natural cycle. But it will help us accelerate this phase of the programme through to conclusion. And the other piece then that we're obviously looking at is where we go from here in relation to booster. And as Paul said at the start, we're awaiting further guidance around that. We're obviously provisionally planning around it, but we need further guidance in order to finish out those plans over the winter.
And sorry, Niamh, just something that has popped up during the week, for the last few weeks, rumbling on about public health advice on communions and confirmations. Has that turned up as an issue in contact tracing, any kind of socialising around those type of events?
Yes, they have been consistently a problem throughout the pandemic when they did take place. So similar to weddings, funerals, and indoor gatherings. They are an area as we go around the country with the Director of the Public Health, where they will highlight where there were communions and the after events, not necessarily the church ceremony, but the after events with family and friends do provide environments for the disease to transmit.
Sorry, Colin, just very quickly to clarify, in the 12-week scans, basically is the situation at the minute that partners aren't allowed, and now they will be?
Yes, so in the first iteration, it was a 20-week anomaly scan. So now as we ease the restrictions further, we're going to issue guidance tomorrow on the 12-week scan. It may well be that some hospital groups are already facilitating this, but it's going to be reflected in national guidance, and that's our intent.
Just, Paul, you were saying that like the kind of next few weeks are extremely important in terms of like getting more people vaccinated. What goal are we working towards, if that makes sense? Because like that we were talking last week about how herd immunity doesn't really seem to be the goal. So when you say the next few weeks are important, like what are we aiming for?
It's the maximum uptake in each element of the population that we're working through, Paul. In simple terms, I mean, you know that we're at 89% today, dose ones. You see when they all come up, that'll very simply and very quickly see up to 90% of the population having been fully vaccinated. But the specific goal and direction that we're set by government is to maximise the uptake, to the greatest extent possible in every population age group we work through. And that's what we're doing. And, probably well above and beyond where any of us expected we would be at this point in time.
Just very briefly, it was touched on about the WHO. I think you were saying, Colin, about the WHO calling for wealthy countries such as ourselves not to use booster shots. I mean, should we be planning for a booster campaign when, like that, there is this debate at the minute about whether we should be doing it at all?
I think what their statement was for the month of September, I think it was. I'm not sure the exact wording was. They were calling for more equitable distribution to allow some of the developing world to catch up. As we said earlier, we've received preliminary advice, and our advice here is to try and align it with the flu vaccination programme, because there's synergies in terms of the target population and the time of the year where our flu vaccination programme usually begins, late September, October. So that's what we're planning towards till we receive more definitive advice. The WHO, as I understand it, I'm subject to correction here, was looking at was the month of September.
I think the most recent advice you're talking about from WHO about less developed countries, I think that's where your question was focused. Look, from our perspective, and Damien and his team have done this throughout the whole vaccination programme, we've always been scenario planning ahead what might happen with various vaccines, population types, vulnerable groups, and we've never waited for a decision and then start thinking about it. So we are doing it in parallel now, doing our scenario planning, doing our thinking. Ultimately, this is a policy decision for government, but we are planning and ready to go whenever policy decision is made by government.
There's huge IT implications, logistic implications, distribution, new guidance, and so on. So there's a whole range of things that have to be developed every time we have to replan. So I suppose if we waited till the decision came, so in some cases we plan for scenarios, they don't emerge, that's fine. And the team, or even as we're in here, they're working through that at the moment in terms of trying to look at what that would look like. So, the policy decisions will come and they'll be made. And as Paul said, we'll follow those through. But we have to plan, I suppose, around the scenarios that might emerge out of that.
Yes, hi, Niamh from the Examiner again. I know Anne O'Connor isn't here, but maybe one of you would have some information on how the backlog from the cyber attack is being addressed. We'd heard stories about thousands of patients cancelled. What's happening there?
First of all, just on three pieces. The cyber attack and the progress on it has gone really well over the last few weeks. So it's well over 90% of our systems, both in the acute hospital side and the community side, up and running. We are dealing with issues of, at this stage, largely around email, replacement of servers, and some remote access points for people. So that's the kind of level we're at from the cyber attack. Secondly, we have seen some impact not related to the cyber attack on some of our hospitals who are extremely busy at the moment and having to delay some elective care. And that's largely been out of protection for patients because our emergency departments are still running at about 20% above our 2019 levels, which would be the base level before the pandemic, before our pandemic. And then thirdly, just in terms of overall lists and the impacts we've always seen at every stage of the waves or phases of COVID, the elective lists grow during COVID, and we do get back to them at each stage after it, and that's our intention to do it again this time. So we are looking at plans to start to address some of the backlogs, and we are already addressing some of the backlogs, but it is certainly very challenging with the demand we see in our hospitals at the moment, particularly for elderly people coming forward for care.
Did I understand you right that hospitals are now in August cancelling elective care because they're too busy?
There's just been 2 or 3 that have. Certainly UHL has for a period of 3 days last weekend. There's not a standard approach across all sites, and that's nothing unusual, Niamh. When sites get to a point of level of risk, they will take that decision and we'll support them in that decision. And it is a very busy August so far from what we're seeing. But no, there's not a standard approach across the board.
Senator Maloney from the Irish Independent again. I think the New York Times ran a feature article in relation to the reopening of hospitality in New York State, and there was also an issue in Israel that arose within about a fortnight of indoor hospitality being allowed with necessary, doorkeepers, and vigilance and so on. And they found a sharp fall off in the level of vigilance being operated on doors and so on. And in the context of the hospitality sector currently seeking smoothing of arrangements, to put it that way, in a meeting with government today, do you have any concerns that the level of vigilance that was promised will fall off as indoor hospitality continues to operate?
Personally, I think this is not just an issue with indoor hospitality. I think we've all used the phrase living with COVID over the last year, 18 months. And that is the phase that we're looking forward to the next 18 months. And certainly we're living with it very differently because we have a vaccination programme and that supports government to make decisions around reduced restrictions. But I do think personally that's going to be a real challenge for us next things. What does living with COVID really mean? What are the measures that we need to continuously embrace and adopt for a sustained period of time? So I think it's well beyond just the indoor hospitality sector. I think it's about how we live our lives, how we socialise in a very different way because we have protection, but equally in a very different way because we know COVID is still across the world.
Any thoughts specifically on hospitality, though, that owners of establishments might deem it too costly or whatever, and be more lax in terms of guarding and checking people's black squares?
Well, the only thing we'll say, look, the advice and the regulations and the guidelines are there with the best intentions of protecting people. So it really is a call to everybody. And it's not, I don't really single out one sector because it is for all. The advice for everybody is just to continuously embrace them for a sustained period of time.
Yeah, just Jack Power at the Irish Times. Just another small question in relation to, I think there was a stat there on the 16 to 17-year-olds who had registered for a vaccine appointment. And obviously you would have seen a lot of them turn up at the walk-in centres. And I think there was roughly around a third that hadn't yet registered for an appointment. Is that kind of figure kind of a small bit concerning in terms of trying to kind of get to that cohort? Obviously, walk-in centres are one way to do it, but is there a sense that they're not, I suppose, rushing to the portal as kind of other age cohorts might have?
We've seen that as we come down through the ages, certainly the higher ages, and Colm Henry touched on this earlier on, more vulnerable, massive quick uptake. As we've gone down through the ages, particularly as we've gone down 40s, 30s, 20s, the uptake remains very high, but it takes a longer period of time. And certainly what I witnessed, and Colm gave his examples last weekend, what I witnessed in vaccination centres was quite reassuring, quite moving actually, to hear the reasons why younger people, 16 and 17-year-olds, came forward so quickly. So no, I think we would be encouraged by what we're seeing rather than concerned at the moment.
Typically, it does run over a 3 to 4 week cycle with ages. There may be a rump at the start and it goes through. And just to illustrate it, nearly over 20,000, 25,000 people have registered over the last 3 days. So there's a constant flow through. So I think we were very happy with the initial uptake in 16 to 17. It's pretty consistent with all the other age groups. And the fact that others have chosen to use the walk-in initiative is even better. I suppose we give more encouragement, and we'll keep working on that over the next couple of weeks.
I'm not Paul Quinn from Virgin Media. I'm not sure if you mentioned this. Do we have any figures on the number of cases in vaccinated versus unvaccinated, and the same with hospitalizations?
We'll be producing data on that. So the figures I gave there were over a few months period of ITUs, where we did a separate survey with our NOCA, our ITU colleagues. And the finding there was a very small proportion of patients admitted. I think I'll just repeat those figures before I go on to hospitalisation. But a very small proportion of figures of people admitted to ITU from the end of March to July were fully vaccinated. If I could just... Sorry?
It's 80-20.
Yes. But this is to record this, we have to do it over a time period, because the average length of stay in ITU could be 15, 20 days. And it takes some time before you build up, because the relative small numbers are a reliable figure. But 80-20 is a fairly reliable figure. Our figures going back from March to July show much lower, and that's because perhaps there was lower. It's going back to a time when there wasn't as much uptake of vaccination. But as of now, it's certainly 80-20, or indeed more than that.
We're just saying that, I mean, such an area, the proportion of people who are in hospital not vaccinated is high in proportion to people, the percentage of the population who haven't still received a vaccination, if that makes sense. So it's a high proportion of those, and a higher proportion of those people in hospital have not been vaccinated with COVID.
Normally, the more we vaccinate people, then there's millions of people vaccinated. So we're going to see more of them in hospital because there's actually many, many more vaccinated people. But I think I showed this slide last week, but the overall proportion of people coming into hospital who the hospitalisation rates in terms fall in relation to the number of cases, so because of the effective vaccination programme. So it won't be a surprise for us to see fully vaccinated people come into hospital because there's many more of them now, and that represents the breakthrough infection, even the best case scenario of 95% reduction in hospitalisation, which is the kind of figures we're getting back on the Pfizer and Moderna vaccine. We'll see that for every, that there will be a 5% of people who would be hospitalised for one reason or another because they haven't mustered an immune response or otherwise, and they're repeatedly exposed if there's high levels of local community transmission, may end up at hospital. But there's a big reduction in hospitalisation. And that figure again, that graph last week from the UK is showing I don't know if you remember, the cases versus deaths in January and February, the cases from day 0 to day 50 of the pandemic during that surge then versus the numbers of deaths showed an exact mirror image, but the deaths are completely stunted now. So the harm done to people as a result of COVID-19 is greatly stunted and attenuated at hospital level, ITU level, and at death level.
Sorry, just go back to the question I asked yourself earlier, Paul, just about the kind of aim, like that you were saying, in terms of the overall vaccination campaigns to get uptake as high as possible. Like, how high is possible? Do you know, like, it just seems like a lot of these aims, they just seem a bit vague, you know? So, like, what, like 100% is technically possible of the entire population, but surely there's a figure that the HSE is working towards.
There's a few determining factors. First of all, at what age level of the population does government policy decide to go to? That decision is being made now in terms of 12 to 15s. So that's a proportion of the population. Second issue is what proportion of that age population, particularly 12 to 15s now, will there be an uptake? And we will approach it exactly the way Damien and Colm has spoken about, giving the right and required information, informed, trusted information, and letting people make decisions. So we want to respect that and go through that. So it is a function of uptake, and it's a function of the percentage of population who government decide to vaccinate. And so, you know, and after that, it's all uptake. Supply, which was a factor throughout, we feel is not a factor now. Supply factor is coming through strong and consistent, particularly from Pfizer and the mRNA vaccines overall. So, you know, we have a different issue now, which we had, you know, for 3/4 of the vaccination programme to date, which was about supply. Supply is there now. What population do we go to, and what's the uptake in that population?
There aren't then, like, you're not saying, you know, oh, we want to vaccinate, you know, 95% of the overall population. Like, when you talk about like a few weeks to hold on, like how many weeks? Do you know what I mean? Like, it again, these, like, I think that people would like to know what we're actually trying to achieve here.
Yeah. Well, look, I think the reality, Paul, if you look over the past 7 months now of this vaccination programme, there's been various targets or forecasts put out there, whether it's the EU target to get 70% of the population adult population fully vaccinated. We have done that. We achieved it fairly well. And the ECDC had set that out as an original target. Then there became other conversations around herd immunity or not herd immunity. We've always remained focused on just whatever government policy is, vaccinating and maximising the uptake. And that's exactly where we're heading at right now. So, you know, we're not developing newer targets or new targets. Specifically to your question of what we mean by a few weeks to get out of that, what I specifically mean is when you look through August, we'll continue on the maximising the adult population vaccinated. We will start the process next week of vaccinating the 12 to 15-year-olds with dose 1 and getting them back to school in September doing dose 2s. That is a really well-protected elements of the population that we will have at that stage. So that's the kind of period of time frame. Let's get through August. Let's get all of those people in scope and young children vaccinated on the highest uptake we can. So in early September, I and the HSE are saying let's try get everybody to hold their nerve and hold their guard through that period. And it doesn't mean we unlock it all after that. Based on Senat's question, we still need to live with COVID.
Thank you. I know that the Cyberattack particularly hit your statistics in relation to mortalities, but since deaths was mentioned, and there's obviously been great attenuation, as Colin was saying, in relation to deaths seen across the Western world with vaccination. What can you tell us about the levels of death in Ireland, insofar as you can, after the attack?
Colin, few NEFIT usually report on the mortality figures, other than we can certainly say over the last period of time, significantly come down based on, and particularly from the age population that were most vulnerable. So I don't have the actual death numbers here. They are produced daily, but are certainly regularly by NEFIT.
The deaths have gone down, definitely reflected in the UK experience, and also the majority of deaths are in the unvaccinated population, looking back over a similar time period as the slide I presented in ITU. So what we see in Public Health England, which are reporting on greater numbers, they report, I think, in over 200,000 Delta cases now. I think 14% of those cases are in vaccinated individuals. They're reporting a subset who presented to EDs and emergency departments have been admitted, and I think around about 10% of those have been vaccinated, and then they reported on a small subset of people who died with Delta variant, and again, a higher proportion, but the majority are unvaccinated, but a higher proportion are fully vaccinated, and that's because the deaths tend to occur in older age groups, people who are vulnerable, and the breakthrough infections, if it's going to happen, tends to be in those. If it's going to, a breakthrough infection is going to cause illness, hospitalization, ITU, or death, it will tend to be in people with underlying conditions and those in older age. And I think, as I report, for example, on our own, if I could just repeat that slide, because come back to the earlier question in ITUs, when we look at the figures over the past few months, there were, as I said, between April the 1st and July the 29th, which predated Delta to a certain degree, after 143 cases, 78% occurred in the unvaccinated population. But after 31 patients admitted to ITU and were at least partly vaccinated, 27 had an underlying condition. So that reflects the very, very sick end of so smaller volumes, still great proportion unvaccinated, and in those of the sickest of the sick, underlying conditions.
When is it anticipated that death statistics may come back? And, you know, would it be too cynical to imagine that the cyber attack has allowed health service to downplay the number of deaths for whatever reason, because there's been criticism of it even being mentioned in the first place?
We've been, from the very beginning here, Shannon, if I recall, we were criticised last year for over-counting deaths because but if I remember, people from the WHO and otherwise who visited our shores saying that we were extremely open and honest, recording certain deaths and probable deaths based on the opinion of people, for example, in nursing homes and otherwise. So there's never been any sense, and I can say this with great confidence, never been any sense in this country of us underplaying or understating deaths, either those that were confirmed dying with COVID or those that, in the opinion of the medical practitioner, that it was a probable cause. In fact, we've been criticised from the beginning for much the opposite, which is counting probables as well as definites. So.
When deaths might be reported again as part of the daily output? Yeah, but have they? I thought they had not been turning up in the NEFIT bulletins since the cyber attack. Am I wrong on that?
Yeah.
My understanding, they are doing them weekly, I think, as Niamh said. Yeah.
Thanks. Paul, just Laois County Council reported yesterday that there was the HSE advice on public health grounds that meant they couldn't give the go-ahead for electric picnic, and obviously a lot of young people and maybe a lot of old people as well would have been looking forward to that possibly later this summer. When do you think the HSE will be in a situation where we'll be happy to give the go-ahead for such kind of large-scale public outdoor events?
Well, just to be clear, Mark, the decision by Laois County Council is a decision under the Planning Act, as I know from my previous history in life. So they would take advice and input from a range of statutory authorities. We are one. They would take all of that advice and they would make a decision which they made to not proceed or not give the licence to proceed. So it wouldn't be solely on our advice. So, you know, that would be the input. From our perspective and a wider public health perspective, we'll continue to give our advice into government from a HSE perspective and how we protect hospitalisation, sickness, mortality, and public health advice in its widest sense will be provided in through government, through NEFIT. And that's the route in which government take their advice on wider public health restrictions and guidelines and opening up of society. But certainly we will always contribute to statutory processes, of which that was one, and we gave some advice.
HSE advice was cited as key advice by Laois County Council yesterday, as that's why this couldn't go ahead. Like, was there any attempt by the HSE to talk about, saying vaccines only, maybe, or some, some sort of creative kind of solution to allow such an event to go ahead?
No, and the HSE advice would have been on the basis of where we are in the pandemic, where government policy is, where public health risks are, and where we need to continue the process that we're on. That would have been the context for our advice.
We're all watching very closely the modelling from the optimistic to pessimistic scenarios, which talks about the number of cases, but also hospitalizations and ITU. So I'm sure all that was taken into account in projecting forward as to where we may be at the time of the event.
It could be too much of a risk to kind of.
The modelling is, the best we can do, as we've had to do from the beginning, is look into the future and project based on the best intelligence we have about the nature of the virus, and in this case, on the impact of the vaccine programme. And we've been provided with modelling, which is constantly amended, of course, based on trends, which gives us information, not just the number of cases, but the impact on hospitalizations and ITU.
And Colin, just on that, the latest modelling, like the numbers seem to be plateauing, as you kind of remarked yourself. Are you hopeful that that we won't see the kind of pessimistic projections coming to pass? Where the case would have been up into the 2,000, 3,000, 4,000 cases that we saw back in January.
Well, the current projections are based on Philip Nolan's group, and I'm optimistic to what are called central scenarios and pessimistic scenarios, which range in terms of numbers of cases between 4,000 and 13,000 cases per day in September, and translating that into hospitalisation, there's a wide range. So I know Philip is constantly amending that based on where things are going. We did expect, for example, we thought this week or last week we might be facing 2,000 cases a day. It's a happy surprise that we're on the optimistic side of this. Plateauing is a strong word. I think it's certainly while we're seeing the figures, as I showed in the graph, bump along at 1,200 to 1,400 cases per day, neither are they going down. So it may well be that we're seeing something a little bit different than we're used to before, that exponential growth. We're seeing a steady rise or a steady up and down as we maybe approach 2,000 cases. But at the moment, it's certainly more cause for encouragement than not that we're facing this number of cases over for a number of weeks now. But as we often say, and I know it's very tedious, we're not our passive bystanders here. It's our own collective efforts, based either on engaging with the vaccination programme and also protecting ourselves and others through the other measures that we've advised and even others have spoken about, that will keep those figures down, not just us staring at the figures, praying, hoping that they'll fall, they'll drop down again.
Just on the modelling.
Yeah, so Philip has updated his models, and we have taken them on board from a test and tracing perspective. So we use them then to forecast swabbing demand and call demand for contact tracing. So in the latest of the models, those two models, the optimistic and the central one, are much flatter curves. The other curves are steep, and we don't seem to be, thankfully, on track for those at the moment. The other ones, though, do just slowly rise and continue to rise until the end of August. And it's more at that point that they look like they may come past the peak and start to go into decline. So that's the piece that we're continuing to manage at the moment, is are we still going to deal with 1,500, 1,600, 1,800, even though it's not jumping to 3,000 or 4,000, but it still is a large number every day.
Be at the end of August? What's the current forecast?
Well, on some of those models, you would be looking at about somewhere between 3,000 and 3,000 over 3,000 cases at that point. But it's a kind of a slow rise in getting there. Now, we are still falling behind all of those models at the moment. We're still below the optimistic in those latest models, which perhaps would bring us to a lower peak than what's in those models. But again, with the impact of vaccination and this different wave that we're in, it does seem to be a different kind of growth than previously.
The one figure plateaued mark are hospitalizations. So while it's very close to 200 now, 193 today, could possibly be 200 tomorrow, 39 a few weeks ago. That's a very steady increase week on week. So that is the one that gives us concern. Yes, it's off a lower base, and yes, it's relatively lower to the total hospitalizations we deal with, but it has a very disproportionate impact on our hospital system. So that is the one that hasn't plateaued, unfortunately. And I'd be much more confident if we begin to see that plateau and decrease, and we'll watch the other trends as well. So